Hey everyone, Dr. Kuniak with a mini lecture for the week. So I had a handful of questions come up, and it led me down a path of thinking about some ideas for this mini lecture. So one of which was folks were emailing me questions about diagnoses, and particularly we covered like what to do with a person when they don't have a diagnosis, how to kind of arrive at a diagnosis in a short amount of time so that you can render a diagnosis in the first session, even if you're going to change that, which you very likely will, or you very likely may, I'll say, because maybe you won't. Um, I had some folks asking me questions about. I was having a hard time coming up with this diagnosis. Is that normal? Should I be paying more attention to something? No. You can only know so much about a person in one session in a 45 to 55 minute time frame when and it may even be less than that, getting to the content that you need. But that's the requirement that's put on us. So you have to come up with some sort of a diagnosis. Medical doctors do this too. It's just a little bit easier for them because they're checking off symptoms in a box that line up a little bit easier than us. Our clients are a little harder to narrow down. So you just do the best that you can. Fit within larger categories, get to kind of a general diagnosis, and roll with it. But I had some questions come up about what to do when a person brings in an existing diagnosis. That's totally fine. You may have quite a number of clients who come in and say, I think it's a reasonable question to ask. Have you ever been diagnosed with anything? Have you ever carried a diagnosis? They very well may have. And so you can use that as a starting diagnosis. You can use that as evidence of, whatever. I would write it in the note that, client is being diagnosed with blah, blah, blah. They had provided evidence that, which can just be verbal, that this was a previous diagnosis that they carried. This seems to be supported by XYZ, and this will be the diagnosis for this time. And then you can amend it if you decide that no, that actually does not fit. You can adjust it. Sorry, I saw a light turn on my devices. But you can start with the diagnosis that was there. Just mention that it was a previous diagnosis that they brought in. If they know who gave it to them or where it came from, you can note that too. You don't have to do that for our documentation for this class, but just for your own clinical work in the future. There was a psychiatrist that the agency that I was working for contracted with a whole lot. So many times I would put diagnosis blah 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 as provided by Dr. Chaudre at this date and whatever. That's fine. You just evidence as much as you have with it and you can keep it. And if that's the diagnosis that sticks, that's the diagnosis that sticks. It's fine. It made your life a little easier. But you can also update it if it's not fitting for you, given some time. And you just write that in a note or write that on a treatment plan or another document or something like that and just update it. And that's what it is from then on. Your agency or practice or whatever may have a process for that as far as where they hold the diagnosis in the charts or something like that. Just follow that. Otherwise, just note it wherever you note these things and update it on your billing information and go from there. So the other thing that I want to talk about then is this idea of not over-promising things and being trapped in a corner. I was trying to think of stuff that's useful early on in the learning to be a counselor process. One of my professors used to refer to it as being a rookie counselor. So one of the things that I think we get into is clients ask us, because they're scared, they're nervous, they're unsure, whatever the case may be, they ask us to kind of help them to feel better about something, whatever the case may be. And so that may be, I can remember being asked, well, I know you have to call CYS. I mean, this is a scary one, but I know you have to call CYS, but they're not going to take my kids away, are they? I don't know. And it's okay to say I don't know, or that's beyond my scope. I know what my area of the practice is, or I know what my area of the field is, and then I don't know. This is as far as it goes. We can talk in a live class sometime because I think it would be better for Q&A purposes about experiences that I've had in courtrooms and stuff like that. I've had attorneys, not judges. Judges are usually a little bit more reasonable in my experience. It's not always the case. But attorneys who've challenged my credentials, who've challenged my, you know, they want me to say where this parent should go, and I say that's out of the scope of my practice. I didn't do any sort of permanency assessment. That's not how my practice works. That's not what I was contracted to do. And they'll say, well, but you're a doctor, don't you? You have to have an opinion. First off, as much as I want to say I do have an opinion, but I can't give it to you, I just say that wasn't a part of my assessments. I didn't assess for permanency. I assessed for whatever I assessed for, but not a part of my practice. I'm not contracted for permanency services. That's what that's called, but you could say whatever. There are less scary ones, though, where, a client wants you to give them advice on parenting, and it just doesn't sit right with you. First off, we're not supposed to be advice givers in the first place. We're supposed to try to help people find their own advice. But, I often tell students and supervisees, if you've got alarm bells going off for some reason, even if they're mild, just listen to them. Buy yourself some time. So that's my point in bringing this up is you don't have to promise anything to a client. You can say, I need to think about that for a little while, or I need to take that to my supervisor. The simplest one is, that's a really tough question, and I'd really like to kind of mull around about that for a while before I give you advice, and it's not going to be appropriate advice, or it's not going to be helpful. They may push you and say, like, no, I want to hear what's on the, this is really important to me, I want to hear whatever is on the top of your head. If you're feeling uncomfortable with it, just say, I understand, I know that this is really a really important topic for you, but I simply don't feel comfortable giving you that information right now. Sorry, I'm dealing with like a sinus infection or a cold or something like that. I hope I'm getting over it soon. But I am prone to occasional coughing fits, so we'll try to finish up before I get to one. But yeah, you don't have to feel painted into a corner. When I was working in family-based, it used to come up all the time because we would have family support funds that we had available. So some families knew about that, so they would want us to, gain access to those funds. Well, I had to seek approval for those, so I couldn't promise that we were going to go out and buy them a week's worth of food or gas for their car or something like that. I had to go back and ask our clinical director what we had available and if this was a reasonable, service to pay into, given the needs. That was a required part of our services. The federal government required us to take a certain portion out of the budget and put it towards this because that's who was paying us, so that's what they required. Excuse me. But we only had so much each month, and so we had to get approvals for that before we could just divvy it out. But families would want to know, and it was I have to go back and talk to my supervisor about that. I understand that this is important for you, but I can't just give you an answer right now. More often than not, though, it was something like, well, this was the wrong parenting decision for my ex to do, right? I'm not stepping in that one. That almost always is, and I will give you an example of when I accidentally did step into it. And I knew it too. I knew it when I did it, that it was going to backfire on me, and it sure did, exactly like I expected it to. And so I should have known better, but, So anyway, so clients will try to get you to side with them, against this partner or against their kids or their kids against their parents or whatever the case may be. Don't get yourself painted into a corner if you can help it. Well, I don't have an opinion on that. They're not in the room right now. I'm not at liberty to make that kind of an assessment. I understand what you want, but I don't think that that's actually going to fulfill this need that you have. Whatever. Let's focus back on you. I can't do anything to help that situation, or, you're asking me this. Let me think about that for a little while. I'm not sure if that really fits within what we're trying to accomplish here. You can also just say no. But, there's room, and buy yourself some time. Give yourself the space of a day to think about something. So there was this one time where I was working with a client. I was working I was actually a program director at the agency, and I had worked with this particular family when I was a counselor, and they had come back round again, and so I assigned them to a team that they were working with, and then through a series of events, the stepfather, who was very involved when I was working with them, wanted to see about receiving individual counseling separate of the individual counseling with me out of my private practice, separate of the counseling that they were getting for the family, and that's totally appropriate. So I thought ahead. So I'll say it's totally appropriate, but it needs boundaries put in place. And so I had those conversations about like what's discussed here is between us. This is not something that I'm going to discuss with the team, unless there's a reason to breach confidentiality. But likewise, I'm asking you to keep the things that we talk about in here between you and I. I don't want that to leak in and interfere with the team's work. The client said they understood. We were working together for several months. Didn't seem to be crossing any boundaries one way or another. Was bringing up concerns about their partner. And so my goals were completely innocent, but it was still wrong. I lapsed in judgment, made a poor choice. Knew it was an accident when I finished my statement, and then was hoping that it wouldn't turn into anything else, and it did. They wanted to, so then I gave an example of a series of symptoms that I thought could be at play here to try to. The innocent piece was I was trying to kind of downplay what was going on with their partner, to try to take that out of frame. So this wasn't a concern anymore, so that my client could focus more in on their behaviors and kind of ignore what was going on with their partner, so that they could take more ownership of their own behaviors. What ended up happening is they took that home and then were essentially using this as though I had diagnosed the partner, which I didn't. And I mean that very plainly. That's not me just trying to cover up for a mistake that I made. I did not provide any sort of diagnosis. I didn't even use a diagnostic title of any kind, a name. But anyway, and so we're trying to use my experiences with the family, my presence with the family from the past, etc., to kind of push to say that they were right, and Dr. Kuniak agreed, and so they should change their behavior. Well, that was completely wrong. That was completely out of context. I went about my business, didn't know this was happening or anything like that. During the next supervision I had with my team, the team was really upset, and they were upset with me, because this had then leaked into their session. They were kind of blindsided by it, and they had a right to be. But I was upset, and I did disengage services then with that client, because they broke our contract. The contract was that these things would not cross, and it did. So that wasn't a safe place I could not provide counseling anymore. So, but that was an instance where they were pushing me to try to get an understanding of what was going on with their partner, and I should have just said, this doesn't need to be discussed in this session, or I need some time to think about this before I answer you, or all those examples that I just gave you. I should have used any of them. And I didn't. I felt pressured, and I gave in that one time. It always bites you. The time you give in is the time that it will bite you. So I hope that that's helpful. I think it's useful to remember that there's only so much that we can actually do in our sessions. Clients will want us to change things about what's going on with them, or what's going on with the member of their family or something like that. It may not be possible for us to do what it is that they want us to do. We can't take certain things away from people. We can't take anything away from people. They have to feel their feelings. They have to deal with their thoughts. But we may be able to do something, but we shouldn't have to make those, and it would be unwise to make those decisions just because it's being demanded of us. I understand clients are desperate. They want change to happen. They're uncomfortable. They're afraid. They're whatever the case may be. But that doesn't make it our responsibility. So, hope this was helpful. I will look forward to talking more with you. I have another note that I want to bring up, but I've already done a decent amount for this mini lecture, so I will bring that to the next live meeting. Let me know if you have any questions, comments, concerns. I will look forward to seeing you all in class coming up. Okay? Take care.